Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. I hope that you all have been enjoying our sessions on Facebook with our top experts as much as we have enjoyed presenting them to you. Today, I'm happy to welcome you to a very special session, Preventive Healthcare in Pre-Diabetics and in Diabetics. The International Diabetes Federation has recently mentioned that 537 million adults are now living with diabetes worldwide, a rise of 16% over 2019. It is very certain that diabetes is one of the fastest growing global health emergencies of the 21st century. The latest IDF Diabetes Atlas also reports that the global prevalence of diabetes has reached 10.5%, with many people undiagnosed. By 2045, 1 in 8 adults will be living with diabetes. To make matters even more alarming, India is home to the second largest number of adults with diabetes worldwide, throwing a lot of socioeconomic and financial challenges. Diabetes, unfortunately, is also not a condition that will show up many symptoms initially. Undiagnosed and uncontrolled diabetes can affect every aspect of your health. But the good news is that it can be controlled, prevented, and even reversed. So today we are going to learn all about preventing both prediabetes and diabetes, and also learn vital innovations and aspects of its treatment, so that you don't let diabetes and the complications of the disease take you by surprise. To discuss this fascinating topic, I welcome Dr. Sibabrata Banerjee, who is a senior consultant physician at the Apollo Multispeciality Hospitals, Kolkata. Dr. Banerjee is an expert in internal medicine and critical care with over 25 years of experience, and he passed his MBBS in the RG Kar Medical College and completed his post-graduation at the NRS Medical College and Hospital. He was Joint Secretary, Indian Medical Association, headquartered in Delhi, and is now working with the Indian Medical Association, West Bengal. Welcome, Dr. Banerjee, to this Facebook Live session. Thank you so much for taking the time out and joining us here. So today we are going to discuss the topic of preventive healthcare for diabetes and prediabetes, and we look forward to your valuable guidance. So we can begin with just discussing about what is prediabetes and what is diabetes.
In a very easy language, diabetes means elevation of the blood sugar. And pre-diabetes means it is a condition of the body which predisposes the elevation of the blood sugar. Now, what is the figure? If blood sugar, fasting blood sugar is more than 140, 126, and PP blood sugar, that means 2-hour postprandial blood sugar, is more than 200, then we are diabetic. That means in morning, in empty stomach, if you do blood sugar, that is fasting blood sugar, that should be more than 126, and your 2-hour post-lunch blood sugar should be more than 200. This is number one criteria. And number two, your HbA1c, that is glycosylated hemoglobin. What is that? It is the average of last 3 months blood sugar. It is the reflection of average of your last 3 months blood sugar. Now, if the HbA1c is more than 6.5%, then the patient should be stamped as diabetic. Now, what is pre-diabetic? If fasting blood sugar, that means morning blood sugar, is between 100 to 126, or your post-lunch blood sugar or PP blood sugar is between 140 to 200, 140 to 199, that is 140 to 200, then you are pre-diabetic, along with your HbA1c should be 5.7 to 6.4%. Because if you cross 6.4, then you are diabetic. So 5.7 to 6.4% is your HbA1c for pre-diabetes. And fasting sugar should be 100 to 126. And PP sugar should be 144 to 199, or rather 200. So this is pre-diabetes. Now these pre-diabetic patients, why it is important to identify a lump sum portion of these patients may convert to diabetes in near future if they don't maintain the proper lifestyle or instructions.
So, doctor, does that mean that pre-diabetes can be reversed? So, if with proper lifestyle modification strategies, can it be reversed?
There is no definite documentation by which we can tell the progress of this metabolic disarray in the body can be totally reversed, but it is proven 100% any person can retard the progress of deterioration of his or her blood sugar level by altering lifestyle as well as with some medications in some situation. So 100% reversal, no documentation, but 100% retardation of the progress is 100% possible.
So what are these lifestyle modification strategies that they should adopt, or what medications may be given if somebody is diagnosed with prediabetes?
Now, see, lifestyle modification is such a word which is very easy to tell, but very difficult to maintain. In my long duration of practice, I came in touch with so many of my doctor friends, including myself, who are selling their advices but not maintaining that lifestyle. So it is very easy to tell you 1, 2, 3, 4, 5, 6, but sometimes it is really very difficult to implement. But we should have some focus and we'll try to reach the goal. Not possible always we can reach 100% goal, but if we try to reach that, it will help us. Now let us start one by one. First, exercise. Now, any sorts of exercise will help us. But what exercise? We should have some ideas, okay? Now, 30 minutes a day or 150 minutes a week. At least you have to do some aerobatic exercises. Better do have some brisk walk, if possible light jogging, if your cardiac status permits. Few guidances are there where 10,000 steps per day is very, very important. 10,000 steps per day is very, very important. Few guidance are there where it is told you should stand up once every hour. So you should stand up once every hour. Okay. So at least 10 standing must be needed. So 1 stand per hour, 10,000 steps, 30 minutes in a week, in a day, 150 minutes in a week. At least this is a basic guidance of exercise, what we should do. Now, regarding diet, most difficult part, because do you know Indians really like food? Food is one of our important part of life. Moreover, India is such a country where diversity and versatility of the food is very much important. Okay. If you see South Indian food style, it is different. If you see Eastern India food style, particularly Bengal, Assam, this is different. North India different. Western India absolutely different. So every state is having their own style of food. But we have to take some basic ideas. At least 1 gram per kg weight protein we should take. Suppose I am 80 kg, I am having body weight. So I must have 80 gram of protein per day, 80 gram of protein per day at least. Okay, this is number one advice. Number two, my food should have at least 70 to 100 gram of carbohydrate. It should not be carbohydrate free diet because it is harmful. Number three, we should not take oil free diet and we should not take very oily diet. At least 5 to 10 ml of oil is needed. Which oil? There are a lot of discussions on it, but ultimately it is proven better to take the traditional regional oils. Like in Bengal, we are using mustard oil, that is good. In South India, they are using coconut oil, that is also good. We can use ghee, even cow ghee, for our regular preparation of the food. Olive oil is very good. We can use olive oil, But butter itself is not very much recommended for our day-to-day lifestyle. So we should take protein, we should take carbohydrate in a moderate manner, and we should take oil in a very moderate manner. Along with this, we should not forget to take good amount of vegetables and fruits. Reason behind, they are the main source of different multivitamins. So that is our diet habit. Another is your exercise. Now in lifestyle, apart from these two, another is addiction. Now, if you have some questions on addiction, then I shall, at that point of time, I shall highlight. But as much as possible, we should avoid addictions. Last but not the least is the weight control. So by exercise, by diet, our main motto will be to control weight. Indians have a propensity of central obesity. So we will try to avoid central obesity. Clear? So diet, exercise, avoidance of obesity, particularly central obesity, and avoiding addiction. These are the 4 important lifestyle modifications which can deter the progress of pre-diabetes to diabetes.
How does one understand that they are at risk for pre-diabetes or diabetes? What kind of, are there any identifiable risk factors that a person can be aware of or screening?
Yes. Now, who are having the risk? Now, suppose I am having a strong family history of diabetes. That is very important. My parents are having strong family history. My grandmas, grandpas, they are having strong family history. They have history of diabetes. In that case, I may develop diabetes later on. So this is number one. Number two, suppose I am one of my twin brothers. Suppose we are twin and my another brother developed blood sugar, then I am having a propensity to develop blood sugar. Number three, suppose from my very childhood or from my very young adolescent life, I am a bit overweight. I am a bit overweight. I am having a propensity for weight gaining. In that case, I may develop diabetes mellitus. Fourth, I have high blood pressure or I am having some cardiac diseases in a very premature age. In that case, I am having a high risk of developing diabetes. Last but not the least, in very small issues, very often I am contracting different type of infections and which is healing very slowly. In that case, I should have a close watch on blood sugar because very nearly I may develop diabetes. Sometimes during pregnancy, females are developing gestational diabetes mellitus, that is diabetes during pregnancy. After delivery of baby, usually for a long duration, gestational diabetes mellitus spontaneously getting cured. But out of them, 25 to 30% later on may develop diabetes mellitus. So, these are the conditions: family history. If you are one of twin, high or hypertension or heart disease prematurely you have developed along with high cholesterol or triglyceride, gestational diabetes mellitus, very obese persons. These are the high risk groups who in near future, if not maintaining lifestyle modification, may develop diabetes mellitus.
So, what about the preventive health care, as in going for health checks? So, when should people start checking whether they have checking their blood sugars, checking their blood HbA1c, and all that? I mean, when should that start, and how often do they have to do it?
I should give you one example. Suppose you have purchased one Mercedes car and you are driving it very nicely because the car is very nice. Now, when should you take that car to the garage? When the car is broken down at that time, or from the very beginning, the day it has its own appointment for checking in the garage? We should go in the scheduled day when the car is running perfectly, but it should have its own routine checkup. I think you will agree with me. Health is like that. Human is like a car, like a machine. We have a clear idea yet, particularly in this pandemic scenario, what we are facing. Patients are coming to us after getting sick
Yes.
But it is always better, it is always easier to handle the situation if they come to us on a routine basis. Just it's a routine check. I am having appointment with Dr. Banerjee after 6 months. Every 6 months, he is giving me these investigations. I should do my investigation. I should go. If there is any problem, he will give some medicine and everything will be fine. But we are not doing that. Only we took appointment to the doctors when we are very sick. So in that case, the word cure comes, but not prevention. So for prevention, we need this type of regular discussion so that everyone is getting aware how can we prevent the progress of blood sugar or prevent the deterioration of the blood sugar. So if I am having those high risk factors, suppose I am obese, I am having a very stressful life, I am having different addictions, I am having premature heart disease, cholesterol, high blood pressure, I am having a bad family history. In that case, we will consult our doctor for getting investigated to prevent the progress of the disease.
Absolutely. So when it comes to diabetes, there is both type 1 and type 2 diabetes. So could you explain to our viewers what is the basic difference in prevention when it comes to these two?
Now, there are two types of diabetes mellitus. One is type 1 diabetes, another is type 2 diabetes mellitus. Now, basically, in a nutshell, in a very nutshell, in type 1 diabetes, we are not having any sorts of insulin, a hormone which needs to control blood sugar in our body. So insulin, you need to control blood sugar. If no insulin, blood sugar will be high. In type 1 diabetes mellitus, there is no insulin, so blood sugar is high. Clear? Now, in type 2 diabetes mellitus, what happens? You are having insulin, you are having high blood sugar. Then how is it possible? Yes, you are having insulin, but those insulin are defective insulin. So you are having defective insulin. Those insulins are qualitatively not good. For that reason, they cannot work properly. Hence, your blood sugar is high. So, I'm giving you one example. I am a poor man because I don't have any money in my home. So, I am a poor man. So, I am type 1. And one of my friend is having very old banned 500 rupee note in his home. But that is also not working. He is having notes, but those notes are banned notes. So he is having notes, but those notes are banned. So he is also poor. He is having money, but he is not having money. So that is the difference between type 1 and type 2 diabetes mellitus. Treatment process is a bit different. In type 1, usually we start with insulin directly. In type 2, we have a lot of options for medications. We have a lot of medicines we can give it.
You already spoke a bit about some of the early signs and symptoms of diabetes, as in wounds not healing. Are there any other early warning signs or symptoms that the people must be aware of?
In diabetes, classical 3P is there: polyphagia, polydipsia, and polyuria. Polyphagia means you will be very hungry every time. Polydipsia, you will be very much thirsty every time and will take a lot of water. And polyuria means you will pass urine very frequently. So these 3P symptoms are very classical for diabetes mellitus, type 1 and type 2. Interestingly, in type 1 diabetes, weight loss is a bit more. In type 2 diabetes, weight gain is there. Usually, we are getting weight gain. In type 1 diabetes mellitus, usually, we are getting features in less than 30 years of age. In type 2 diabetes mellitus, usually we are getting those features in more than 30 years of age. Apart from this, very often we will see recurrent infections in the patients, visual problems, frequent power changes. They are changing their glasses frequently without checking the blood sugar. Power of the eye, refraction error is very frequent in uncontrolled blood sugar. Recurrent urinary tract infections in both males and females. In skin, recurrent fungal infections are there. Sometimes we are getting some warning features of diabetes mellitus like disorientation, unconsciousness, strokes. These are very much important, and pain abdomen. These are very much important in diabetes mellitus with uncontrolled blood sugar.
Why is it important to control diabetes? What are the complications that one can face if the diabetes is uncontrolled and untreated?
Complications of diabetes mellitus is endless. We cannot finish it.
Okay.
So from head to foot, almost every organ can be affected by diabetes mellitus. Let us start. We can have a lot of neurological features. Patient may develop stroke. Patient may have neurological features like tingling, burning sensation of hand and foot, neuropathic, different neuropathic features. Patient may develop muscle weakness, very common. So these are the neurological features we are getting. Eye is very important. Blindness, one of the most common reason of blindness in India is type 2 diabetes mellitus. So diabetes mellitus is very important for developing blindness. So cataract, retinal problem, hemorrhage in eye, all these recurrent infection, conjunctivitis, whatnot. All sorts of eye problems can be developed in diabetes mellitus. Recurrent oral infections, these are very common. Skin infections, fungal infections, these are very common. Pulmonary tuberculosis or any sorts of fungal infections in lung, these are very common. Pneumonia is very common. At this point of time, we are facing COVID. COVID are getting deteriorated or in severe form in case patients are having diabetes like comorbidity. So this is very, very important for right at this moment in this pandemic situation. Okay. Now, apart from that, liver function can be deteriorated. Kidney is another organ which are getting very often affected by diabetes mellitus. Diabetes and kidney. This is getting another subject. Last but not the least, heart and cardiovascular system. Cardio-diabetic. Now it is getting another subject. So heart can be involved in type 2 diabetes in different format. So that is very important. So you can see
Every organ
In
is.
a nutshell, all organs in the body can be affected to such an extent any human being may suffer from severe mortality and morbidity.
One reads a lot of advertisements, or we always see many commercials which say that there are certain vitamins or powders or drugs that can completely cure diabetes. How should people view these kind of things? Is there any truth to it?
Now see, we are also getting a lot of advertisements, commercial advertisements. We don't have any definite document. This vitamin, if we take for a long duration, it will prevent the progress of the disease. We don't have any definite documentation. But as a whole, vitamins and minerals help us in a lot of ways. And science is such a subject, it never stops, it always progresses. So what today we are discussing, after 50 years, maybe this discussion is too backdated to be discussed. Okay, so science is like that. So I do not know in near future whether it will be proven a particular element or multivitamin or vitamin discovered in such a way it will help to prevent the progress of the disease. I don't know. But right at this moment, I cannot tell you name of any vitamin or mineral.
If somebody is overweight, is there any goal or immediate target where they can see a good improvement in their sugar levels if they lose at least a minimum number of kilos? Is there something like that, doctor?
Now, body weight and uncontrolled blood sugar has a direct relationship. You are having more body weight, you are having more blood sugar. Now, we have to think a target. Now, regarding body weight, if our surface area is less than 25 kg per meter square, that is one of the ideal. According to some rigid organizations, they are telling it is less than 23, but 25 is okay. 25 kg per meter square, less than 25 kg per meter square is okay. That is in the form of body mass index. But a common man does not always understand what is body mass index. So if I express in the form of body weight, it is a bit approximate, but I can tell you, if you convert a person's height in centimeter, suppose I am 6 feet, I am having 6 feet height. So 6 feet means 180 centimeter. So 180 centimeter minus 100, your height in centimeter minus 100 is equal to kg of body weight. That is your ideal body weight. That means I am having 180 centimeter length height, minus 100 is equal to 80 kg. So a 6 feet man ideal body weight should be 80 kg. This is very gross and approximate. But if the target is like that, then everything will be fine. Okay. So that is regarding body mass index and body weight.
So I think, doctor, you have given our viewers a lot to think about on how they should be alert about both prediabetes and diabetes and take the adequate measures at the earliest to make sure that the sugars are controlled or detected, or prediabetes is not allowed to progress to diabetes. So thank you so much. So viewers, you have learned today that diabetes can be managed, prediabetes diabetes can be stopped if caught early and treated with very simple measures, but as doctors said, measures that are easy to say but difficult to follow, but follow it we must. And that includes losing weight, cutting back on daily calories, and staying physically as active as possible. So don't take a chance, get yourself screened for diabetes and pre-diabetes, manage the disease, and don't let diabetes or its complications take you by surprise. We will be, of course, very happy to take comments and further queries from you, either on our Facebook page, or you can put in your comments on Facebook Messenger. And you can also catch more of these kind of trending topics in healthcare in our YouTube channel. And we are always available on our website and on our social media and other digital platforms to answer all your queries and be of assistance to you. So take care, be well, stay safe. Thank you so much, Doctor. Thank you, viewers. Namaste.
Thank you.